Okay, so we are now live streaming on Facebook via Zoom. We've got this whole technology thing worked out. I'm Larissa Finley, the VP of Education for the Greater St. Louis MGMA, and I'm here with Barbara Faupel. If you want to introduce yourself, tell everyone who you are, what you do, that kind of thing.
Like she said, I'm Barbara Faupel. I am the practice manager of Allergy Consultants in Creve Coeur, Missouri, and former president of Greater St. Louis MGMA.
Thank you very much for joining us for a coffee talk. With everything going on, we have decided to do these just check-ins to kind of connect with our membership because we aren't having live meetings right now. We are having webinars. You've most likely been getting emails about those, so you can definitely check those out. But we wanted to I wanted to have Barbara really check in about what it's like day to day in the medical practices. I work for an IT company, but we have a lot of medical practice clients, but at the same time, we're working remotely just to try to prevent anything, any infection, things like that. So we're 6 months in. So first, like, how are you holding up?
Better now. I definitely, especially in March and April, it was just, day by day of what are the changes? What are we going to do? My mind would just race at night, like trying to sleep, but I'm like, well, could we do this? How can we protect this? It definitely is, sadly, the new norm is set in to where I'm getting a little bit more sleep at night, which is good on the one hand, but also sad that we're, 6-7 months into this.
Mm-hmm.
And there's no end in sight.
Yeah, it's when we first found out in March, we were like, okay, so we can work in the office a little bit, but then we just decided to go remote and changed everything, and that first period was insanely intense.
Yes. It was kind of a slow shutdown, at least for my practice, because we're a private practice. So it was up to my 4 physicians to make these decisions. Not a huge, hospital, trying to make, those decisions. So it was a slow process of, okay, this physician's going to start working from home. We're also not, unlike many other, so our own personal situation, we were not set up for telemedicine. We are based in Creve Coeur. We don't have, pre-COVID, the rules and regulations for telemedicine did not apply to our patients. So there was no reason for us to have that kind of technology and to have bought into any of that. We didn't have the rural clientele that you used to have
Mm-hmm.
To have the telemedicine. So I had never, obviously I've been doing this now for 8 years, 6 years as the practice manager. I have lost count of the amount of webinars, conferences, everything that I've been through. I've never focused on telemedicine because I knew it wasn't something that my practice needed, and there were other things that needed my attention. So crash course in trying to figure out, we've tried a couple platforms before we finally landed on one, a lot of hit and miss. And so
that must have been so crazy. If you, first of all, you have all of the pandemic stuff, and then on top of everything else, you're trying to implement this whole new technology that, that in itself would be enough to cause sleeplessness.
Yes. Yeah. Yes. So, trying to, and then we have, some of our physicians, some of our staff are immunocompromised. So at the beginning when, we didn't know how is it spread, how fast is it spreading, trying to figure out who was going to work from home, who was going to be in the office, how are we going to be able to take care of patients? Can patients come in? Do we only do remote, but we're allergy and asthma. So physically in the office, we do skin testing, we do asthma breathing tests, we give allergy shots. So there's a lot of things that is so hands-on that we either had to pause, or some things we're still not doing asthma breathing testing in office. Some of the hospitals have set up special spaces for those types of tests, but we don't have that kind of room and technology. You know, when people are blowing out to do those tests, we can't make it safe for the patients that come after them or the staff in the room with them. So it has just been kind of one, you know, type of patient at a time, and then figuring out how can we still take care of them. And are we going to do it in office, or are we going to do it remote? It has been a crazy 7 months. It really, really has.
Well, and I mean, in your particular specialty, your patients are higher risk, aren't they, with the pre-existing conditions? I mean, I know having asthma and everything, that's like, that adds a whole other level. And there's different populations too, like
Yes.
elderly and things like that, but particularly for you guys, has that influenced like how you do your day to day, or was that just kind of one of the risk factors that you just had to deal with?
So we've, my doctors are members of what we call the Quad AI in our language, but it's the allergy and asthma group. And they, especially at the beginning, I mean, it was almost daily that they were sending out information, you know, researching, trying to figure out how at risk are asthma patients, just in general day to day. You know, can they go to the grocery store with a mask on, or are they have to completely isolate themselves? Then we also had patients that are a severe asthma patient that is, say, on a biologic, that they cannot stop their treatment. You know, it's having to make that decision of, even though the office ended up pretty much closing to patients, we have to treat them. We have a moral obligation to take care of these patients. So, you know, working around that while doing as much, you know, our new patients and our follow-ups remotely to limit the amount of people, especially at the beginning. We started slowly bringing patients back end of April, early May. We started the very slow rollback. But it has definitely been, you know, just a constant, what are the hazards, who is the most vulnerable, and how can we help them?
Well, I mean, just for my part, I wanted to thank you and all of your practice and all of our members, healthcare workers. I know that there were big outpourings of everything in the first 3 months, and now everything else, I don't know, election crazy. It's insane.
Yeah.
You know, 2020 is just, I don't even know. But
yeah,
yeah, so
seeing the memes, it's amazing what 2020 has been called.
Yes. So it's just amazing that you've been able to be there for your patients. And I know that a lot of our other members, being there for their patients is number one, but also trying to deal with a seemingly impossible situation where it's, okay, there's this thing, then there's this new pivot. That's like one of the words of 2020, right? Is to pivot and adjust. And just the stamina and the energy that you need to keep going. And I mean, so how do you feel where we are right now, coming from where you've been, right? Looking forward with maybe another 6-7 months.
Oh,
sorry. I don't want to overwhelm you. Good thing we have our coffee, right?
Yeah, oh yes. Oh yes. I feel better now when, especially I would say end of March, early April, almost daily, I was attending webinars from either the Quad AI, a ton from national MGMA and state MGMA of, you know, how to do telemedicine, how are you going to talk to patients, just like all this constant, because everything was changing. And it wasn't obviously, I mean, going forward, we're definitely going to have conferences where we have classes on how to handle a pandemic. That wasn't something we focused on. You know, I mean, our focus when it came to emergency was obviously natural disaster and then shooter. We weren't, I mean, I didn't have in the back of my head, well, if there's a pandemic, this is what I'm going to do. So I definitely feel overall that my colleagues and I definitely feel very confident that, you know, trial by fire, that we got this. One of my doctors early on said to me, you know, I know you didn't sign up for this, because I was not only in office all the time, we had doctors working remotely. So I was making house calls to get them their information that they needed, going back and forth. And I said, well, it's not something, you know, you would have put in a job description. By the way, if there's a pandemic, this is what you're going to have to do. Now it's going to be in a job description. So it's something just kind of, I don't want to say making it up as we go along, but really, you know, figuring out one step at a time, what works, okay, this doesn't, and then let's try something else, and be open to the fact that our first attempt or our first guess at a way to do something didn't work, and being okay, you know, not having hurt feelings, you know what, okay, that wasn't right, let's try this, or okay, we were incorrect on how this spread, or what's safe and what's not, and 6 months later we've changed our mind on, you know, whatever that may be, and that we're still, you know, evolving, and to be okay with that. But I do, next 6-7 months, I really think that the kind of rolling with the punches thing, we're all incredibly good at. We've all made it this far, and I definitely feel that we can do this. Definitely.
Yay. I'm happy we're recording it because that was great. We're going to type that up and make it a slogan.
I'm optimistic overall, mostly because I know we haven't seen each other in person since, I guess, the March meeting.
Yeah, I
probably.
think so. And even then, that was at the very beginning of when things were starting to get risky. That was the last thing, and I think there were only 20 people or so.
Yeah.
But that was the last time I shook someone's hand as a.
I remember feeling very unprofessional, because I was kind of stepping back and being, I'm sorry, I'm not shaking hands. And I did feel one of the first things I was taught when it came to being professional, my mom, her biggest thing was, you have to have a good handshake. It's got to be good. It's got to be solid. You know, that you have to have that first impression. And even I pulled it out of, to keep it, I want to say it was a national MGMA magazine, but I don't remember. I've read a lot lately in the last 6-7 months, but there was a whole article about what can we do instead, because handshake is so a professional standard, and it's probably, I'm not going to shake someone's hand for, I don't know.
Mm-hmm.
But to what going back, that, you know, I haven't, so I guess the last big thing that the local chapter did would have been the Medicare event in February, where we had a full room like normal. seeing all the faces we hadn't seen since maybe the holiday party or maybe the conference. And, you know, knowing all these people for as long as I have, they're all such stellar professionals that I know they've all just kept their practices going. I have 100% confidence that they definitely stepped up and their practices are better for it.
That's awesome. I've definitely heard that a lot of people are working very hard, undoubtedly, to keep things going. Absolutely. So I do have a question for you. So implementing that connection with patients during time of pandemic, when they do come into the office or even telehealth, are there any things that you're doing, like practical tips that you can share with other practice administrators about how to kind of just create a little bit of warmth and connection? I mean, I know I'm in marketing, so I have all sorts of ideas about how to do that. But
a lot of, for us, was kind of opening up how we connect with patients, because in the past we don't have a phone tree, so it's always been a live answer, and the doctors call back their own sick patients, but they've always had to call in. Myself and one of the physicians control the Facebook account. Patients are actually messaging us on Facebook, and I'm getting the notifications, and I'm either messaging them back or having either a medical assistant or a medical receptionist, depending on the question, call them back right away. We're emailing with patients, just avenues and connections that we haven't utilized before to give them, you know, however they can get in touch with us, you know, just being more open to ways that we haven't in the past had a connection. Obviously, you know, for anyone who's not on Facebook or isn't comfortable with email, obviously our phones are still on. Unfortunately, do get very busy. But
are you still having our big? Are they still answered live, or have you implemented a phone tree or anything? Or
I'm sorry, you cut out.
Oh, that's fine.
Can you re-ask the question?
Yeah. Do you still have your phones answered live, or have you? Oh, very cool.
Yes, we're still answering live. We have, despite obviously, you know, everyone's having their budget for 2020 kind of didn't, you know, occur as, you know, anticipated. But we have done what we needed. We were finally able to get our new phones. We're working on, you know, getting fiber and trying to implement things because this is going to be, I mean, who knows how much longer. So we just have to be prepared for it. So we've been implementing kind of lit a fire for some things that had originally been more backburnered. Just kind of, as you said, pivoting what our focuses have been. So yeah, so we're still live answer and just any avenues really that patients have, we're much more open to how they can reach us, and so that we can take care of them.
Well, and that's awesome that you're meeting them where they're at, right?
That's
just wherever, like every possible digital platform, wherever you're going to be.
Yeah.
You can be there, right? To make it it easy for people to continue their care and do everything that they need to do.
Right.
I mean,
and then also the connection between, you know, when it comes to getting closer, we're a small staff, but this has 100% brought my staff and doctors closer together. Me making house calls to the physicians, the doctors and the staff have each other's phone numbers, they'll text. and to keep in that constant communication, especially when a physician was working from home. So-and-so called, hey, give me a call. You have a patient that needs you, as soon as you're off this call, let me know so I can give you this information. And even though it's 2020, our fax machine never stops. Coming and going, it's still massively being utilized.
Well, it's one of those legacy technologies that's pretty, I mean, from a technology standpoint, it's pretty darn secure. There's not any going to be like hacking or crazy stuff going on.
As long as you make sure you're faxing the right number.
Right. They have that disclaimer that says, if you don't need to see this, it's not for you, get rid of it. I mean, yeah.
Yes, but it is definitely, we've been in office this whole time, the staff have been. So when there were no patients and we were having daily meetings, this is the new change, or this is how we're going to do this, or brainstorming with the staff of their ideas. It has definitely brought us all much closer together in working as a team, because we're also in a way quarantining with each other as well.
Mm-hmm. What do they call it? A pandemic pod? Is that what it is?
Yes. Mm-hmm.
Where you stay in the same bubbles of everything. So like for us, we've been working remotely and we're in constant communication all the time. Like you, we have our phones answered live. We even have an answering service after, but we don't come into contact with each other because our guys still go on site, so that if someone gets exposed, we can still be up and running. So we have like a lot of redundancies in place
now,
so that we can still, because with technology, I mean, like you've mentioned, phones, fiber, all of that, like now people are bringing up technology to the point where, okay, this is what we need, so we're going to get up there now. And then I know for me personally, I love telehealth. If I don't have to drive to my doctor or anything like that, I will just say, okay, I'm going to take 15 minutes for work, do telehealth if possible, and be done with it. Not every appointment can be like that, but
right. Yeah, we still have our the majority of our follow-ups are still telehealth, but our new patients, we need to skin test them if we're starting them on immunotherapy. And then obviously now we're giving flu shots, more important than ever for that. Absolutely. So, having some patients obviously need to come in, and then some, we're giving them the choice, and some will say, absolutely, please, do the telemedicine. But then some say, I just really, it's been, 7 months since I've physically seen my doctor. I really would feel more comfortable, coming in. So it really and some of them don't have that technology at home, or don't have good reception or service that they can't. And we're either having to do a phone call, which is absolutely, it's literally better than nothing. But if they can then come in so that we can take care of them if we can't do telemedicine.
It's again, everyone's kind of at a different point with where they're at with especially access to technology or knowing how to use technology, that kind of thing, what they're willing to use. And so it's amazing that you're able to, you have to be masters of everything. Great.
We've luckily I have control of updating the website. So in the blog, we have very explicit instructions on how to use the telemedicine platforms we're using, so that if there are questions, or I've had some people that we've emailed the instructions to, because like you said, meeting them where they're at. If they're, at a place where they can't write it down, or they're just really not understanding it, we'll do that. Just whatever, we can do to help.
Yeah. So I think we're kind of coming up on our time. Is there anything that you would like to share with other administrators? Maybe something you've learned. I don't mean to put you on the spot. I didn't send you these questions ahead of time.
I guess the biggest thing I've learned is how even though we're still not seeing each other live, or in person, I have really, been grateful for how, especially, MGMA itself at all the levels have stepped up to help us. I'm a part of the national listserv, the daily COVID-19 listserv. And I see, every once in a while, I'll see someone from the St. Louis chapter on there answering a question, and I get to see their little face in the box, and, oh, there's, this person, the helping each other, and, whatever, expertise we can give each other. It has been amazing to see that, and just, not, oh, I know this, but I'm not going to share it. There has just been 100% support across the board, and I really have liked seeing that.
That's awesome. I think that just having like the MGMA, even the local one, there's any attempt to maintain that connection to get through it together, right? I think in times of difficulty or struggle, people reveal their true strength and character. And I know, listening to your story and just everything that everyone's been through, it's really inspiring. So I think it's awesome. And just so you know, we are going to be doing the virtual Medicare update in February. So that is still on. That was a very well-attended event besides the annual conference. So that's going to be coming up virtually in February, and many other webinars. You can continue to check out social media, but thank you very much for taking time out of your morning and drinking coffee with me and chatting.
It was great to see you.
Good to see you too. Hopefully we'll see each other in person, distance, not, whatever we can do. But that concludes our coffee talk for this morning. So thanks everyone.